Hey everyone, it's me. It's country time. But today we're not talking about my country husband. We're going to talk about something that I myself have been dealing with for the last 20 years. I have been diagnosed with peripheral neuropathy, polyperipheral neuropathy. So your peripheral nerves are located outside of your brain and your spinal column. Now, before we go any further, let me make a disclaimer. I am not a doctor. I cannot diagnose you. I cannot give you any ideas on medications that you can take. All I can do is tell you what I have been doing, what I have been dealing with for the last 20 years. So your peripheral nerves are divided up into two things. It is your autonomic nervous system and your somatic nervous system. Your autonomic nervous system deals with the areas of involuntary functions and your glands. Now, your glands are things such as your thyroid, your parathyroid, your adrenal glands, etc. We're not going to get into those. I'm just trying to give you a little information. Also, your somatic nervous system deals with your impulses from your ears, your eyes, your hands, and things like that. Now, I do have some notes that I'm going to be glancing down at throughout this as we talk, and just to give you a little bit more information that I can't retain myself. So let's go to that. So there are three types of peripheral nerves. If I happen to mess up something and you're in the medical profession or you're a doctor, you can correct me. I don't mind being corrected. More information for more people is all that I'm worried about, helping other people to get past this. So you have three different types of your peripheral nerves. You have your motor, your sensory, and you have your autonomic. I may slip up and say automatic. I've been saying that all day. So this is like my 27th take of this video, but it is your autonomic nervous system. Let's start with your motor system. Okay, your motor system sends impulses from your brain to your body. Now, when you have nerve damage in this area, you can have problems throwing a ball, catching something, holding something. You can have difficulty walking. You can have muscle spasms. You can have pains, and also you can have problems using your arms correctly. Now, your sensory system, and that kind of is self-explanatory. You use your senses. So anything that you can sense, a touch of something, the heat from something, it can be affected. Now, when those nerves are damaged in this area, it causes tingling, numbness, pain, and you can have sensitivity to touch. Now, your autonomic nervous system, this is the system that regulates like your heart rate, things that you don't have control over, your heart rate, your eye control, your blood pressure, things in that area. And when you have damage in this area of the nerve, this can affect you by having constipation. You can have diarrhea. You can have urinary problems. You can have sexual dysfunction, different areas. So that's just a generalized statement that I'm going to give you. Now, they don't actually know what causes this, but there are some causes that can cause damage to your peripheral nerves. You can have an accident. You could have been exercising or lifting weights and things like that and damaged your nerves somehow. My case, I didn't have any of those. They also, sometimes when you start having neuropathy, they start looking at diabetes. Now, diabetes, as most of you know, is when you can't control your blood sugar. And this sometimes can damage your nerves and can cause you to have diabetic neuropathy. Now, I was tested for that. I do not have diabetes. I was pre-diabetic at one point in time, but that has resolved. I don't have any issues in that area, so it's not from diabetes that's causing my neuropathy. We're just going through the motions, doing test after test after test, trying to figure out exactly what is causing this. Now, a little backstory on me. Back in 2003, like I said, I have been a nurse for 32 years. I was working one night. I was doing a 12-hour shift from 7 p.m. to 7 a.m. at the hospital. And I just noticed that I was having this weird sensation right up under my right breastbone. And it was sort of like a tight band that went around to my back. So after I got off work, I went down to, no, I didn't. I went home. And then later on, I came back and went to the emergency room because the tightening got worse and that sensation just was really bothering me. So what they did a CT scan. Of course, the CT scan shows nothing. If you have any type of nerve issue, you'll know that. CT scans show nothing. So they referred me to a neurologist. I went to see the neurologist, and I sat down and talked with the neurologist. He came up with some things. We did MRIs of my occipital lobe. We did of my brain, and we also did of my back. So we had all of that covered. All of those tests came back negative. Now, if you have been dealing with your nerves for quite a while, in my instance at least, I have had all my tests to come back, mostly all of my tests to come back negative, but all my scans have really come back negative. So that was really showing nothing. But the pain got to be so debilitating that I had to take off work. I started having difficulty walking, and I just had to take off work. I took off work, I think, for like 6 weeks. And during that time, I had severe fatigue, so much to the point where I was sleeping 15 hours plus a day. My mother at the time was really worried about me, and she wanted to call 911 to come check on me, but I was okay. It was just the fatigue. And at that time, I was diagnosed with fatigue syndrome. So when you have fatigue syndrome, the least amount of movement that you do can cause you to feel so drained. So I felt drained mostly all day long. Eventually, all of that picked up. I was able to move around a little bit better, so I went back to work. So at that time, my neurologist at the time started doing more tests, and then at that time, I developed a blind spot in my right eye. Now, when all of this first started, after I got off work of that night shift, and I told you I was having that wraparound banding type pain, all of it started on my right side. So it was like from my breastbone straight down through the middle of my body, I went numb. And I don't mean like complete numb, but numb that, I couldn't feel my legs. I could walk. So it wasn't completely numb, but it was a numbing sensation. So then I had this blind spot in my right eye. So he sent me to an ophthalmologist. I think that's the correct term. So I went to see him. He ordered some more tests. I had a visual acuity test. I failed it. So he diagnosed me, along with the other tests that he had done, with optic neuritis. Now, optic neuritis is inflammation of your occipital lobe around your eye. It's the nerve in your eye. So that was inflamed. And he sent me for treatment. I was given 3 days of IV steroids, high dose. And then after I finished that, I went on by mouth steroids. Now, if you know anything about steroids, you have to be tapered down off of your dose. So I was given like 125 milligrams a day. Now, most people, when they're on steroids, they gain a lot of weight because they cause you to eat. And it also can cause a lot of irritability and all of that. I went through everything except for the eat. Now, while I was on the steroids, I actually lost 15 pounds. So that was a good thing. That was the only good thing about it. But it can cause a lot of irritability. And oh my goodness, if you have children, you cannot afford to be irritable because that affects them. So I had that diagnosis in June of 2003. So that cleared up. Come August 2003, I got the same diagnosis because I had the same symptoms. Went through the same treatment, cleared up, never had that again. Now, after this, I talked to my neurologist again, and I was like, so with the diagnosis of optic neuritis twice, do you think it could possibly be multiple sclerosis? Because MS has the same symptoms that I was dealing with. And the main symptom that you can develop with MS is optic neuritis. So I asked him at that time, do you think it could be multiple sclerosis? And he told me, well, without an official diagnosis, we have 3 things that we can do. We can continue to just watch you, see what happens. We can start you on the medication. Now, mind you, the medication back in 2003 was $1,500 a month. And without an official diagnosis, your insurance is not paying for that. So, or we can refer you to another neurologist. Refer me, please, because who don't have time for $1,500 and who was not ready to just sit and wait and see what was going to happen was me. So he referred me to another neurologist. He was at the state hospital. He was the #1 neurologist in the area. Of course, he did all type of tests. We had like 15 tubes of blood. We checked for Lyme disease. We checked for Sjogren's. We checked for all type of different things. All of those came back negative. So here I am again in the waiting game. And I'm sure a lot of you who have been dealing with nerve issues have still been in the waiting game and still don't know what's going on with you, such as myself. Now, I was having other issues, and this dealing with your nerves, let me just say this. I probably will be all over the place. But dealing with your nerves and not knowing what's going on with you can cause a real bad mental anguish. You don't know what's going on with you. Things have changed in your life, things that you have no control over. No one can tell you what's going on with you. So I started going through a depression. And this is what really caused my depression. One day, I was leaving out of the doctor's office and it started raining. Now, back then, of course, I could move. Before then, I could move, I could walk, I could run a little bit if I needed to. Now, I wasn't running sprints or anything like that. I wasn't jogging and all that kind of stuff. But I could run if I needed to. So it started raining that day and I was not able to run. I was not even able to walk fast. That affected me so. I just stood in the rain and I cried. Yes, I cried. This can really deal with you mentally because, like I said, you have no control. There are so many things that we as human beings take for granted. The ability to walk, the ability to talk, the ability to hear, see, any of our bodily functions we take for granted. Now, when you lose those things, that's when you realize how blessed you really were. So I wasn't able to run. I was only able to walk in the rain and get drenched. I started having problems with my gait. I was walking into walls. I couldn't control it. And it really affected me because I didn't want people to think that I was drinking and was just drunk and doing these things. So every time I would go somewhere, I had this self-consciousness about myself. Do people think I'm drinking? And that's when the dragging of my leg got worse. And I think it was just a psychological thing, me knowing that people were probably watching me and were they judging me. And every time I got in a crowd, it was hard for me to walk because I didn't want to be judged as I was drunk, I'm on drugs or anything like that. It was just something I had no control over. So I was finally, and it took me years to get to this point, but I was finally able to deal with being in a crowded room and walking. So most of the times I would just go into a room and just sit, get to the closest area, or I would just stay at home. I wouldn't go places. So I was really a homebody and my children were really getting concerned about me. I have 2 daughters, and at that time, of course, they were younger. They are much older now. But so those are things that I had to deal with. So we are going to stop right here. If you would like, you can like, comment, and subscribe, and we'll talk about part 2. Thank you all for listening, and I hope this little bit of information that I have given you has helped someone. And like I said, we'll continue in part 2. Thank you.